Imagine this. A patient is getting a blood transfusion. Everything seems fine until within just a few hours they suddenly struggle to breathe. Their oxygen drops. Their chest x-ray lights up with white out lungs, and yet the heart looks perfectly normal. This is not heart failure. This is TRALI, transfusion related acute lung injury. TRALI is one of the most feared transfusion reactions. It is caused when antibodies from the donor blood activate the patient's white cells inside the lungs. These angry neutrophils damage the delicate lung capillaries, leading to fluid leakage and acute pulmonary edema. The lungs literally drown, but the heart is innocent. Clinically, TRALI presents with sudden breathlessness, hypoxemia, low blood pressure, and bilateral infiltrates on chest x-ray, all within 6 hours of transfusion. The key to distinguish it from TACO or transfusion-associated circulatory overload is that TRALI has normal heart function and doesn't respond to diuretics. Management: stop the transfusion immediately and give supportive oxygen or ventilation. No diuretics here. Prevention relies on careful donor selection, like using plasma from male donors and screening for antibodies. TRALI is rare but deadly if missed. So next time you think of transfusion reactions, remember, not all breathlessness is heart failure. Sometimes it's the lungs under immune attack.